I'm Dr. Samuel Acuff. I'm a research scientist at the Recovery Research Institute in the Department of Psychiatry at Massachusetts General Hospital. I'm going to be talking with Dr. Bergman, who is an associate director at the Recovery Research Institute and assistant professor at Harvard Medical School. How's it going, Dr. Bergman?
It's good, Dr. Acuff. How are you?
Doing well, doing well. I want to ask you some questions about digital recovery support services today. So can we start just what are digital recovery support services?
Digital recovery support services are non-clinical services, non-professional services that are delivered through some type of digital, often online technology. And there are two other kinds of services that are similar to but different from digital recovery support services, which can help make that distinction. So there are also technology-based interventions where those are typically some kind of empirically supported treatment that's been adapted to be delivered via technology, some kind of website. And then there's also telemedicine, which many people are familiar with, which is where a doctor and a patient connect, usually through some sort of video conferencing platform. And so the distinction there is that digital recovery support services are non-clinical, oftentimes where they rely on peer support for somebody to experience their benefits.
I see. So important distinctions there. And could you give us a few examples of what's an example of a digital recovery support service?
So in theory, any service could be a digital recovery support service, provided that it's meant to promote recovery or enhance recovery, and it's delivered through some sort of digital technology. Now, what kinds of platforms are usually considered digital recovery support services? So here we're talking about platforms like online recovery communities, online recovery support meetings. So these might be like 12-step or other mutual help meetings that people would access through a video conferencing platform. There could also be smartphone applications that are used to deliver digital recovery support services. I mean, it could also even be like virtual reality and wearables, things like that too.
Yeah, so as technology sort of advances, this might start to look a little bit different.
That's right.
Now, in some of your work, you've talked about different ways to categorize digital recovery support service. Can you talk a little bit about that?
Yeah, and I think this pertains to the last question as well. Oftentimes, folks will think about technology in terms of the platform itself. So when it comes to digital recovery support services, people often refer to them, for example, as recovery apps. For me, that we can be more precise in how we think about that, right? So there are 4 dimensions along which I think it's helpful to categorize digital recovery support services to improve precision. So one is, what's the nature of that service or resource, right? Is it an online, is it a recovery community? Is it a meeting? It could also be like a cognitive behavioral exercise. So that's one, it's the nature of the resource, or what's the actual service itself. The second is, what kind of platform, or what's the technology actually being used? So in that case, it could be like an online forum, it could be video conferencing software. It could be GPS technology, for example. So there are certain GPS technologies that are used to help people identify potentially risky places from times during their active addiction, right? So that's the second thing, is the actual technology itself. The third is how people can access it, right? So it could be accessed through a website application, a smartphone application, maybe somebody's using a wearable, right? So it's the nature of the service, what technology is being used, how people can access it. And the fourth is really more about like, who is responsible for it. This is more just to give people context. Is it a not-for-profit company? Is it a for-profit company? Is it some government institution that's created it to help people that it's free to access? So those are the 4 dimensions along which I like to think about digital recovery supports, to add a level of precision so that it will help us study them kind of with a higher degree of scientific rigor, but then also to be able to make more specific recommendations for people ultimately.
Absolutely, and I imagine some of those, depending on the categories, might be more useful for some people than others. And so being able to sort of send people in the right direction. Now, you just mentioned a lot of variability in digital recovery support services. So, but broadly, what do we know about the nature, the usefulness, the benefits of digital recovery support services?
Yeah, so in terms of what we know scientifically, it's a very dynamic area. There's a lot of research that are in very early stages. We know by far the most about one particular kind of smartphone application that's a digital recovery support service. It's called the Addiction Comprehensive Health Enhancement Support System, the acronym of which is HS.
HS.
Yeah. And so there's been a whole series of research studies done specifically on HS that's shown that when added to continuing care, so it's the kind of work people are doing after they go to treatment to help them maintain those gains, people that are randomized to get access to HS, they tend to have better outcomes. Now, one caveat there is that the vast majority of these studies have been done with folks that have alcohol use disorder. We know far less about people with other substance use disorders like opioid use disorders, stimulant use disorders. But yeah, so in terms of what we know empirically, way more about this one particular smartphone application, and then for people with alcohol use disorder. The other finding that seems to be fairly consistent across studies are when we look observationally, right? So if we're looking at studies where people are just organically going or using digital recovery support services or not, and we follow those folks over time, what we tend to see is that people who have more severe clinical histories or currently are more severe, so maybe they have like more symptoms of substance use disorder, or they have more difficulties when it comes to mental health, they're more likely than not to use digital recovery support services. Well, why? Partly we think that's because when people are more severe, they're more motivated to try different things, right? So digital recovery supports are one of many different kinds of services people can use. And so when we're talking about people that have more severity, they tend to be more motivated to try new things. And so digital recovery support services tend to be one of those suite of different kinds of recovery support options they're willing to try.
Yeah, so using as many as you can, but also it sort of increases the access to some of these services.
Yeah.
You hinted at a few things in there, but I'm curious, what else do we need to know?
So there are several questions. There are a whole host of digital recovery supports about which we know some empirically, but we know far less about their actual utility, like to what degree can they actually help people. We know people are participating in online recovery communities, so these might be like freely accessible platforms within general interest sites like Reddit, for example. The social network site Reddit has many different kinds of online forums there. And then there are sites that are designed specifically to help people in or seeking recovery. I often will call them recovery-specific social network sites. And then there are online recovery support meetings. We just generally don't know very much about whether participation is going to improve people's outcomes, right? So that's a real fundamental question. Now, when it comes to, well, how do we determine whether they're helpful or not? I think people often will ask the question, well, how do they compare to in-person services? That is one important question, certainly, right? If we think about online recovery support meetings, for example, people often will wonder, well, how do online recovery supports compare to 12-step in-person recovery supports, right? That's an important question. Another important question is, how do online recovery support meetings compare to no service utilization whatsoever? Because when we look at people with substance use disorder, only 10 to 20% are seeking out any kind of service at all, right? So another thing we need to know is, for people who might not be willing to do anything otherwise, would they be willing to try an online recovery support? And then does that actually help them over time? And then I think finally, there are subgroups of folks for whom we think digital recovery supports are particularly relevant. So these are people with like physical disabilities, mobility issues, who might have a hard time getting the in-person services, right? People with psychiatric disorders that might make it challenging for them to seek in-person services, people with social anxiety disorder, right, for example. And then people who live in more remote areas where they just don't have as much access to in-person recovery supports. So those are also like a set of important questions, not just does it work, but also for whom and some of these specific subgroups. And then ultimately also like, if it works, how, right? How is it actually helping people? So I think so those are some of the more fundamental questions we need to answer.
Yeah, it sounds like there are some underserved populations that these could be particularly useful, but the studies need to be done. And there's a wide open program of research for people to do. So thank you so much for talking with me, Dr. Bergman.
Yeah, thanks for having me.